I want you to check out these stats we got from AARP. There are 1.2 million families providing over $16 billion in unpaid care. That's a whole lot of caregiving going on in our state. Mark Hensley with AARP North Carolina is joining us. I got to tell you, that's a whole lot of hours that people are putting in on their own without the help of the medical community.
Tanya, I say this is the everybody issue. Unpaid caregiving is surging in North Carolina. These are adult children of aging parents who need support in their role because not only are they providing some level of medical care, but they're also managing financial risks, they're managing their own health, and they're isolated. One factor is that North Carolina was the ninth nationally in the number of people aged 60 and older. We're now eighth nationally, and we're predicted to soon be the seventh nationally in the number of people 60 and older.
Okay, so we're just going to see those numbers go up as people continue to live longer and things of that nature. That means that caregiving needs to happen. All right, so AARP teamed up with the National Alliance for Caregiving, and I want you to look at some of the findings here. 1 in every 4 adults is a caregiver. Of those, 94% care for another adult, and 7 in 10 family caregivers are employed. So they're balancing work and caregiving at the same time. That's a whole lot.
Yes, you're talking about what we call the sandwich generation. So think about a mom of college-age children who is also working and caring for her parents or in-laws or both. This year's report is truly a wake-up call. We now have 63 million caregivers in the United States. That's a 45% increase just in the last 10 years. This report is the most comprehensive snapshot we've ever had of this country related to caregiving, and it shows that we're at a critical crossroads. These are your neighbors, your coworkers, your family members. As you said, Tanya, 1 in 4 adults is a caregiver, and many of those are under the age of 50.
All right, and so caregiving, I think sometimes people think it's 24/7 care. Sometimes it's the person that needs the care lives in their own house. Sometimes it's they live in your house. Sometimes it means you're getting prescriptions for them or groceries for them, that kind of thing. It doesn't always mean that you're sitting next to them 24/7.
Absolutely. It can be episodic. It can be living next door or having a shared living space, but it certainly adds on to all the things you have to do to run your own household.
All right, so AARP is pushing for legislation that aims to give caregivers help. Let's talk about that.
Yeah, so for example, AARP is still advocating for a nationwide tax credit for caregivers. We know that they are spending on average around $7,400 a year providing this unpaid care. We're also pushing for modernization of caregiving leave for employers, and we're advocating for the expansion of programs that help older adults stay at home independently for as long as possible. Also, as a state and a country, we need to make sure that caregivers receive the training and support that they need to handle medical tasks with confidence.
All right, and so this is something that is a constant thing and a constant push that AARP is doing. We'll see how all of that shakes out. In the meantime, though, as these things progress or don't progress, AARP has all kinds of resources for caregivers.
Absolutely. All resources are online and they're at no cost. The AARP Caregiver Guide includes tips to support a family caregiver from providing personal care, medical management, prescription management, and financial guidance to find a way to have a healthy work-life balance. Plus, we also have ways for you to prepare to be a caregiver. Again, this is the everybody issue, so download AARP How Prepare to Care to learn how to get ready for this journey.
And you know, you said a lot of the caregivers are 50 and under. Is that what you said?
That's correct.
But an AARP, you know, maybe people think of that is for people that are older, but AARP is open. Their resources are open for people of all ages.
They are, and everything online is at no cost. This doesn't connect to membership. But yes, you could be a caregiver as I was in my 30s. And so at some point, as Rosalind Carter said, there are 4 kinds of people, and that is people who have been a caregiver, those who are caregivers, those who will be, and lastly, at some point, all of us will need that help as a care recipient.
Right. And I think people feel very lonely, right, during the caregiving process because they feel like they're the only one that's doing all the things, but there's a whole bunch of people in that same boat, which means there's a whole bunch of resources out there too.
Right.
Mark, we
And there's
appreciate your
also
time. Yeah, go ahead.
I'm sorry. There's also caregiver guilt. You want to make sure that you're doing the caregiver role. Am I doing this the way mom or
Hmm.
dad would want me to? So it's a lot of emotion, it's a lot of tasks, and we are at a critical point in this country that we are truly in a caregiving crisis.
All right, so what we're going to do is we're going to put this interview in the Two Wants to Know section so that you can watch it again, maybe send it to someone that you know is caregiving that needs some help and some encouragement and some support as well. Thanks so much for joining us.